Together we achieve victory over heart failure.
Hello friends and welcome to our today's podcast. I am Dr. Reshma Kshirsagar, working as a interventional cardiologist in Pune. Today we are discussing about a silent epidemic that India is fighting, that is heart failure. In India, the majority of patients suffering from heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of elderly, when we are thinking about heart failure, so what is heart failure? Some questions comes in our mind. First of all, what is a heart failure? See, when people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF, measures how well your heart pumps blood. It is amount of blood pumped out your heart lower chambers like ventricle each time when it contracts. While a normal ejection fraction is around 50 to 70%, individuals with heart failure typically have ejection fraction 30% or less than 30%. Second question comes in our mind, that is why many Indians affected by heart failure. See, there is a number of reasons causes heart failure like hypertension, diabetes, obesity, smoking, or lastly the genetic. Indians are genetically more vulnerable to cardiovascular disease. Next question comes in our mind, that is what are the signs and symptoms of heart failure. First of all, patient comes to us with bilateral lower limb edema, shortness of breath, easy fatigability, generalized weakness, heart palpitations, and confusion like symptoms. So, how can we protect ourselves from this disease? See, our heart works incredibly hard to keep us alive. There are 5 golden rules we can follow to return the favor. First of all, early detection of heart failure through the regular blood tests like NT-proBNP, CRP, etc. Dietary adjustment to maintain heart health like low salt diet, low fatty diet, etc. Third thing, incorporating daily exercise into your routines. Fourth is practicing stress management technique like yoga, pranayam, etc. And last but not least, quieting addictions like alcohol, tobacco chewing, smoking, like that. Lastly, what comes next after heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medication improves quality of life as well as longevity. Along with that, some devices like biventricular pacemaker, ICD, that is implantable cardioverter defibrillator, and surgeries like heart wall repair or replacement will helps to improve our heart functions. And last resort treatment option is a heart transplant. See, the lifetime risk for CH congestive heart failure is around 1 in 5 for both men and women. Remember, awareness and preventive measures are key in fighting this silent epidemic. Thank you.